right, hello and welcome everyone. Thank you for being here today. This is our third training webinar of a four-part series. My name is Samantha Lissette. I use she, her pronouns. I am the Community Education and Outreach Coordinator at the American Institute of Dental Public Health, or AIDPH. I am a white woman with long blonde hair, and I am absolutely thrilled to be here with everyone today. And we can go to the next slide, please. So what we're going to talk about today, I'm going to give us a welcome, go over some housekeeping pieces, an overview of what we're talking about. Then we're going to go into our presentation on non-traditional partners and creating legislative champions. So while we are presenting, please, if a question pops up, you have a question or a comment, please share that in the chat and then be ready to engage throughout. It's very important that we hear your feedback and hear your voice today. So please feel free to share as we move through this program today. And if we could, we want to take a moment before we move on to other pieces to thank our funder. CareQuest Institute for Oral Health is funding this program, which is in partnership with, again, American Institute of Dental Public Health with the Coalition of Texans with Disabilities. And we thank CareQuest for funding this project and making it possible so that we can build out these resources, share them with you all, and be here in community together today. So thank you, CareQuest. These are our learning objectives and are tied to our CEUs. Next slide. Our presenters do not have any disclosures to share today. Next slide. Some housekeeping pieces that I want to share. Closed captions and live transcript have been turned on, but they are not 100% accurate. So please keep that in mind. Please stay muted until we open it up for discussion. No flickering lights if your camera is on, please. And using the chat box is a great way to get help from anyone on the call today, so please use the chat. Closed captions are available on Zoom, iPhone, and Android phones, but live transcript is not. We are recording our session here today. All of our materials, including the recording that we're developing here today, will be on the AIDPH website. We are super excited to be here together in community, so please share your name and your organization in the chat. And if you have any questions about Zoom technical assistance as we move through our time here today, please pop that into the chat and a staff member from AIDPH or CTD will help you out. Next slide. Yeah, so I want to give a little bit of an overview of AIDPH and the program that we're doing here today. Our mission is to empower our community to advance oral health through science, education, and advocacy. And that's what we're doing here today. And as we're doing that, we're working towards our vision, which is a justice-oriented oral health system. At AIDPH, we have 4 communities of focus that work to achieve a justice-oriented oral health system. These are communities that have been historically excluded, marginalized, or oppressed, particularly when it comes to oral health access. These communities include LGBTQIA+ people, veterans, people with disabilities, and people in rural communities. And of course, we also recognize that there is an intersection among these groups of people. So I want to give an overview of the full program because we're here together today on a training webinar, but I want to make sure that we note that this is actually a multifaceted program that we're doing. So we're doing this 4-part training webinar series, but we're also building out an advocacy toolkit that will have 5 sections and will be digitally available. We're building out those sections of the toolkit as well as a form to provide some feedback, and the link to that form will be posted in the chat during this presentation today, so keep an eye out. The third part of this program that we have is a bill bank, which will contain sample legislation for state-based stakeholders to review and replicate advocacy work that will be coming out later this year. And then with our training webinars, we have continuing education credits that are available for all of the sessions that we do if you attend live. And we will provide information on how to request those CEUs at the end of the session. Next slide, please. So again, our training webinar series is a 4-part series. In March, we talked about a community-led approach, and that recording can be found on our website. In April, we talked about using data and shaping policy. Today, we're talking about non-traditional partnerships and creating legislative champions. And in September, we'll be talking about storytelling to engage audiences in Medicaid disability advocacy. And we'll have registration information for the upcoming session at the end as well. So keep an eye out, and we hope that you will join us for our next session. All right, next slide, please. And then again, I was talking about the toolkit. This is just a little bit more information on what those sections will look like and what you can expect throughout the year from this program. We will ask for your thoughts and feedback, and that's really informing the content that we're going over here today. But the other pieces that we'll be launching will be a section on understanding political landscapes, a section on engaging with decision makers, a section on building non-traditional partnerships, and a section on frameworks for storytelling. And the slide here shows an outline of the toolkit with a graphic on the side of what it will look like. Next slide, please. These are our session facilitators today. Pictured here is a photo of all of us. To the far left, we have Chase Bearden and Laura Perner from CTD, who will be leading the discussion today, along with Brooke Hofield, who is the co-executive director of Texas Advocates. And myself, again, Samantha Lissette from AIDPH, all the way to the right. Next slide, please. So without further ado, we will get into the main part of our presentation, and I will pass it along to Chase and Laura.
Thanks so much, Sam. Hey everyone, I'm Laura. My audio description is I'm a white woman with long brown hair. I'm wearing a gold t-shirt with a black cardigan over it, sitting in a bedroom that is both tidy on one side and a little messy on the other. So we're really excited to talk today about relationship building in your dental advocacy work. This was a huge part of our work here in Texas to get a Medicaid dental benefit passed, specifically for adults with disabilities. So just a couple of definitions. The way that we're defining non-traditional partners is, well, let me start with traditional partners would be the advocates, the organizations, the politicians, the staff members that we typically would work with on a given issue during a given session, who we affectionately call the usual suspects. And anyone who might be outside of that we're defining as non-traditional. So that might be people with lived experience. And unfortunately, I think you see this a lot in policy related to people with disabilities, is that people with disabilities aren't always part of the conversation when crafting that policy. So that is a group that we really want to put a lot of emphasis on. Brooke is going to be talking a lot more about community-led groups, how to work with them, how to work with individuals with disabilities. So I will let her get way more into detail on that. Other non-traditional partners with lived experience might include family members of people with disabilities, folks that provide services like dental and oral health care, or just any groups that are in frequent contact with people with disabilities who can speak to their experience. So arts groups, recreation groups, any kind of social groups, that kind of thing. Others that might fall into the category of non-traditional partners include neutral parties like research organizations, academic institutions, colleges, as well as trade associations. Texas has the Texas Oral Health Coalition, Texas Medical Association, Texas Hospital Association, these big statewide presences that can often put a very official stamp of approval on your advocacy work, or perhaps even a bill that you're trying to pass. So sometimes those can be really critical partners in your work. And finally, unlikely allies, either legislators or groups or individuals who might typically support things counter to the work that you're trying to do. Sometimes the stars align and you can actually partner with somebody or a group who you might otherwise be working in opposition to, and that those can make very strong partnerships. And we'll get a little more into that when we talk about building legislative champions, which especially here in Texas, can very often be folks that we are not politically aligned with, let's say. All right, next slide. So just sort of going through that list of what non-traditional partnerships might be, we wanted to ask you all to put in the chat, is there a non-traditional partnership that you have already pursued in your dental benefit advocacy, or a group or an individual that comes to mind right away? And feel free to answer in the chat. We'd love to hear if this is sparking any ideas. And while y'all are doing that, I think we can move to the next slide. All right, so I will call Brooke up to the mic and take it away.
Hi, my name is Brooke. My audio description is I am a white woman. I am wearing a pink shirt, but on camera it looks red. And I am in my home office / my bedroom.
Awesome. And I am Ginger Clayson. I'm going to be supporting Brooke today. So I just wanted to quickly give you all my audio description. I am a white woman with dark hair and a ponytail. I have on glasses and a multicolored, mostly green shirt. And I am also in my home office, which kind of like Laura is half organized and half messy. And with that, Brooke, would you go ahead and tell us a little bit more about who you are and what makes Texas Advocates unique?
Hi, so my name is Brooke Kofeld. I'm the co-executive director of Texas Advocates. We're a statewide self-advocacy organization run by and for adults with intellectual and developmental disabilities.
Awesome. Next slide. So you guys can see there's a pretty standard technical definition of intellectual and developmental disability on the screen. But Brooke, why don't you tell us some more? Is there one definition of disability?
No, so disability is a spectrum. So you're going to have people who are affected by their disability differently. And just because you know one person with a disability, that means you know one person with a disability. So just because someone has a certain type of disability, and you may have a friend with that type of disability who's affected one way, I could be affected by that disability in a completely different way. So it's just based on the person and how the disability affects them.
Awesome. Next slide, please. So now that that's out of the way, Brooke, why don't you tell us a little bit more about Texas Advocates and what you like about Texas Advocates?
So Texas Advocates is like it says on the screen, we're a statewide self-advocacy organization in Texas. We have 300 members and 14 chapters across the state. And I think what I enjoy most about working for Texas Advocates is the unique programs and projects that Texas Advocates gets to do, and just interacting with different self-advocates who come from all different walks of life, all different parts of Texas, but we come together to make change for people in our circles who have disabilities.
Awesome. Next slide, please. So nothing about us without us is a really common phrase in the disability community, But Brooke, for people who aren't as familiar, could you talk to us about why it's important?
Yeah, so nothing about us without us is a coin, an idea phrase around the idea that you shouldn't be having meetings about people without them seated at the table. And that doesn't just mean they're sitting in a chair at the table while you're having the conversation, but it also means that you're having they're giving you meaningful input and you're asking them good questions so that they can give you input. But it also goes a step further, that you're providing them with the support that they need to be able to speak up, because sometimes it's not our natural instinct to speak up for ourselves. So sometimes you have to kind of pull it out and ask questions. That's the best way to truly model nothing about us without us, is not just to sit somebody at the table, but also to continuously be asking questions to get the information.
Absolutely. So, Brooke, do most or any of the Texas legislators or other people who make laws or decisions maybe about dental for people with IDD have IDD?
No, they actually don't, or not that we know of. And so that's why it's important to get people with self-advocates to the table, especially with our decision makers, is because they're the ones there giving the personal input about how the laws that are going to potentially take effect would affect them as people who have lived experience.
Exactly. Next slide, please. So, understanding self advocacy is really the first step to understanding how to best partner with people with IDD. So, Brooke, why don't you give us some ideas of the most important things about being a self advocate and what that is?
So first of all, the most important thing about being a self-advocate is speaking up for yourself. It's knowing when to ask for support, but it's also knowing who to ask for support from. And it's also knowing what you want and then going out and getting it. So if you want, to live on your own, or you want to work, or you want activities to do in your community, you've got to be able to speak up for yourself and go out and get those things. And we know that not every person with a disability communicates with words, but it's important to, as a person with a disability, either ask for what you need or ask someone to help you get what you need.
Awesome. Next slide, please. So on the screen, everybody can see kind of two broad definitions of ableism. But Brooke, why don't you tell us a little bit more about ableism and what that looks like?
So when I think of ableism, so I'm a self-advocate myself. And so naturally, a lot of my friends are self-advocates. And what has happened, not so much recently, but in the past, is I would be at a restaurant with one of them or a few of them, and one of them would want to have a margarita or a beer or something with dinner. And so they would order it from the waitress, and then the waitress would look at me and like for me to give my okay if they can have it or not. So just in that situation, the waitress at the restaurant would be assuming that just because this person has a physical disability or a disability that's not invisible, that they can't have what they want, that just because of their disability.
That's a good example. Is ableism always intentional, Brooke?
Ableism is actually not almost intentional. It's little things that we do every day that maybe to a person with a disability could feel like ableism. like when I was a little bit earlier in my career, one of our self-advocates was in a wheelchair, and he lives here in Austin, and we would go to the Capitol, and I can remember like putting my work bag on his wheelchair, like it had like a little hook thing, and then like later on, like years down the road, realizing that I was just assuming that because Chris had a handle on his back on his wheelchair, that he would be okay with me putting my bag on there, but what I failed to do was ask, hey, is it okay if I do this? Most people with disabilities are not going to be offended if you ask, but they may be offended if you do it without asking.
So I see this word tokenism on the screen. I know you talked a little bit about this, but what is tokenism?
So tokenism is including someone at the table or in your group just because they have a disability. It's not about including them because of the things that they can bring to the table. It's including them because of a characteristic that they have. And this can be very, very dangerous, because if somebody goes and sits on a committee that they don't have the expertise to be on, then that's going to affect their self-esteem. And then in return, that could affect their willingness to be on a committee someday that maybe they really do have an expertise in, but because they had a bad experience that one time, then they may not want to pursue being a part of something like that any further, just because they didn't like the way it made them feel.
Yeah, it sounds like you're describing that domino effect that can happen and how that relates to ableism.
Yeah.
So last question before we move on. Do people with disabilities need to be fixed or cured? Are they sick?
No, we're absolutely don't need to be fixed. Thankfully, thanks to modern medicine, there are treatments for people with disabilities, but that doesn't fix them. That just kind of helps them manage the symptoms, or manage their pain, or whatever their disability may cause them to have. But no, there's no, we don't need to be fixed. We just need to be supported.
The perfect way to move on to the next slide.
All right, so I'm just gonna jump in here and pause and launch a poll. Everyone on the call, are you familiar with the term ableism? That is something that obviously at CTD and Texas Advocates we're well versed in this term, but we don't want to assume that everybody has heard it. So we'll leave that up for a few more moments. And then next slide, please. And certainly this is optional. If you're comfortable sharing in the chat, have you ever felt uncomfortable or unsure of how to communicate with someone with a disability? Feel free to share. And I believe next Brooke will be going over some tips on how to address that. But just real quick, we'll go ahead and end the poll. It looks like most of y'all have heard this term before, so great job. All right. Thanks, and back to you, Brooke.
Thanks. Let me get that. Next slide.
Yep. All right, so Brooke, I know you talked a lot about examples of what ableism looks like, and I think we've all I can't read the questions or the answers in the chat at the same time, but I'm betting lots of people have felt uncomfortable before around different people with different disabilities for various reasons. Can you just give us some examples or some ideas of what people can do to avoid ableism, whether it's intentional or unintentional?
Yeah, so it's okay to be nervous or unsure. I've been in situations, with certain, self-advocates maybe where I've been unsure or nervous or, maybe haven't really known somebody with that type of disability before. And so knowing how to support them, maybe it took time for me to learn. But you got to just be honest and genuine. They're not gonna care that you don't know exactly how to communicate with them or exactly how to support them, but they're gonna care that you took the time to talk to them, to say hello. Yeah. And then it's okay to ask questions. Ask questions about how to support them. Even if you notice something's off, ask questions about how to support them. I was in a situation, I just thought about this, but I was in a situation just a couple of years ago where I was taking a class and wasn't upfront about what my support needs would be. And it took the teacher actually recognizing that I was struggling for me to say anything. And like, I do this for a living. Like, I teach people with self-advocates to speak up for themselves, but I wasn't even doing it in my own life. So if you notice something's off, it's okay to have a conversation, because in that experience, I was able to open up and was able to finish the class that I was taking, or otherwise I probably just would have dropped out before it was over.
So you weren't offended by being asked. It was helpful.
Yeah, it was very helpful. Yeah. And then to have equal expectations. So the person will have expectations of you and how you support them, and you will have expectations of them. So don't just assume because there's a disability that you can't have expectations for what they'll do.
And Brooke, I think you shared earlier with me that you don't want people to assume that someone can't do something because of their disability, but you also don't want people to assume that they don't have needs, like maybe you don't want to assume that they could read or write or process information in the same way someone else does. So particularly for researchers out there, it's important to recognize you might have to do things several different ways to help someone process and understand the information.
Yeah, so never assume anything, always ask questions.
Awesome. Next slide. So, can you remind us, this is, not to be super repetitive to you guys, but sometimes that's also the best way to learn. But can you remind us, Brooke, of some of the common examples of things people may do unintentionally or not that they should avoid?
So like I said earlier, don't be nervous. Don't let nerves dictate your actions. People will be super happy that you talk to them or you engaged them in spite of your nervousness. They will be, if you don't talk to them, then it's going to make them nervous because they're going to think that they're doing something wrong. People with disabilities often just want to be engaged by other people. People with disabilities or people who have disabilities, their lives are very, very, very repetitive. They do the same thing all day, every day for all of eternity. And so they want to have people talk to them and have a genuine interest in what's going on in their life. Talking down,
just like anyone without a disability
yeah,
would, right?
yeah, talking down to someone and because they have a disability. If you're talking with someone that has a speech impediment, nodding, just sitting there and nodding, that can be really hard because they think that you understand what they're saying when in reality you don't know what they're saying. And so that can be really harmful. And then ignoring the person completely, like talk to them, say hi, ask them how their day is, just engage.
Like maybe don't talk to someone's mom, talk to the actual
Yeah, talk to the actual
or yeah.
person. Yeah.
Brooke, should you bring someone with a disability to the Capitol to advocate and just have them stand there and smile and stand next to you?
Absolutely not. You want to support that person to give a message as well, to tell their story. We used to say at Texas Advocates that like we have organizations who can bring the encyclopedia of all the facts and the data and the statistics, but our self-advocates bring the stories, bring those personal stories of how these bills are truly going to affect the lives of people with intellectual and developmental disabilities.
Perfect. Next slide. So I think, Brooke, given some real practical tips of how to include people meaningfully, not tokens, in advocacy, research, in the dental chair, different things. Can you talk about some things you can do? And one, well, I'll let you go first and then I can chime in if needed.
Yeah, so number one is slow down. You know, if the visit takes 45 minutes versus 30 minutes, that's okay. Give prompts as to what you're going to do next. I have really horrible dental anxiety, and so that was always really helpful for me to know, like, okay, so this is what's going to happen, and then this, and then this, and then this, and then I'm going to be done. Preparation is key. Preparing that person for either being in the dental chair and maybe a procedure they're going to have done, or even helping them if you're working with self-advocates to go to your state capitol, helping them prepare what they're going to say so that they're not just standing next to you while you talk. And then remembering that no one's
call the night before.
Yeah, don't call. Yeah, and we've been in situations like that, you know, at Texas Advocates where someone will call and say, hey, can you be here tomorrow? And that's really hard because number one, that puts us as staff in a position to have to scramble, but it also creates tokenism too. And then remember, there's no one size fits all. You can pivot. Like you don't have to do, if you don't have to do something, if there's something that a person is having a really hard time with, a step in the treatment that a person is having a really hard time with, just skip over it and try again in 6 months. And then pay for expert advice. So this is another really important one. So this would be like if you're having someone go to the Capitol with you or go to a meeting with you or do an interview with you, pay for their advice. If you would pay a speaker to come in and speak on the topic, then you should pay the self-advocate as well. And then,
Brooke, are you saying if you would pay someone without a disability?
Yes, if you would pay someone without a disability.
Pay someone with the disability for their advice. Just because it's lived experience doesn't mean it's not expert advice.
Yeah, we're still the expert because we're the ones that live day in and day out with disability. And then the second one would be just ask questions. Asking questions teaches us a lot about people. Mm-hmm. Next slide.
So, Brooke, what did Texas Advocates do to help pass some important dental legislation with Coalition of Texans with Disabilities?
So the first thing we did was we surveyed our members, and these weren't just like questions about dental care at a dentist office, but it went beyond that, and it talked about oral care at home, brushing your teeth, flossing, doing all the things that you're supposed to do daily. And what we found is that a lot of times people had really, really poor dental health. They were going to the dentist every 6 months, but maybe they were going to the dentist and having a lot of cavities when they were there. And so that really taught us that basic education around oral health is important, and why I think that some of the things we did were a large reason of why this bill passed in Texas. People shared personal stories. We had a storytelling team. We partnered with CTD, and we had a storytelling team come to our conference and video recorded people telling stories about their dental experiences. We did Capitol visits. People came and gave testimony. And then we also had education at our annual conference. So if you see on the screen the little chattering teeth, that was a giveaway that we did for people who interacted at conference with our dental project. If they told their story, then they got chattering teeth.
Next slide.
And then these are just some options about some ways that you can connect in your state, and some organizations that we've worked with that have self-advocates of different ages, different disabilities, who would be fabulous people to partner with.
Can I add one thing to that, Brooke?
Yeah.
We didn't give specific links to any of these groups other than the one that you can see, the self-advocacy online, because that would be, hundreds of pages. All of these organizations have statewide and or local groups. So if you Google them with your state name, you should be able to pull them up. And I think they are probably some of the best ways you could connect with individuals with intellectual and developmental disabilities in your local area. And I think there we go. Yeah.
Great. So with all of that, kind of similar question for the chat. Has this kind of sparked any ideas? Are there stakeholders with lived experience that you might engage in your own state level dental advocacy work? I know many of you might have specific patients or other local groups that you're aware of. We would love to know if there are folks or groups that you have in your existing networks to bring into your dental coalitions and networks. So while y'all are thinking about that and sharing that in the chat, we will move on to the next slide. Thanks very much, Brooke and Ginger, for telling us about why centering community voices is so important, how they often get left out of policy conversations, but how to solve that. So the next subtopic we wanted to cover is kind of at the other end of the people who policy affects. It's the people who are making the decisions. And for this, I'll bring on CTD's Executive Director, Chase Bearden, to talk a little bit more about. So
yeah, thank you, Laura. And
Yeah.
I think it's good. I'll give my audio description. I'm a white male with short blonde hair, going gray because of this job. No, I'm just kidding. Maybe it's the legislature, but I play a unique role at CTD, and I've gotten to work with Brooke and Ginger and AIDPH and others. Myself, I broke my neck at 17 as an elite level gymnast. So I went from being a high level competitive gymnast to, at that point, not moving from the neck down. I use a wheelchair now, lost the use of my hands, paralyzed from the chest down. So I've gotten to see both sides of disability and how that affects a person when they're maneuvering, through daily life. And that can also be, going into a dental practice or going into the Capitol. It took me about 18 years to get to the point where I'm at now, where I'm probably considered more acting like a lobbyist within that building and seeing the chair does help. It's hard to miss when a wheelchair is rolling down the hallway, and the governor is also in a wheelchair because they think they get to see the governor, and then they turn around and just see me. So it's not as exciting for them. But, I think the important part for what we all do is helping to guide anyone trying to move through issues and issue areas like this. CTD covers a lot of different issue areas, from healthcare like this to education. I do a lot of elections work. And, I think one of the key things and the things I enjoy the most is the part we're going to talk about right now. And that is legislative champions. For any of you that like to play the game chess, that's really what, when I sit down to try and figure out who are we going to use for this bill to maneuver something through the Capitol, there's a lot that goes into it on our end. And we will literally, tick off boxes as we go. And I think some of the important things about what a legislative champion does and why they're important in your change is that they're the ones who are going to be kind of ushering it through the process in the Capitol. You need that senator or that rep or the staffer that's really supporting it in the committee to help you maneuver these things. And in Texas, we have it every other year. We have session where they're in, and that you can change any kinds of laws. Many of the legislators here are bogged down before session starts. They have their agendas. We have thousands of bills filed, and no bill can pass within the first 2 months. So now you're down to a window of 4 months to pass thousands of bills that all have to be heard in both chambers, passed out of both chambers with a lot of technical issues. You want a well-versed champion that in that time period is able to move something forward for you. It's difficult because you never know what a legislator is going to do or say about anything at any time. They could get a DWI, which affects your bill hearing the next day, and they may not see something going through. So there's a lot of barriers and things that you have to deal with and adapt to at all times. But it's trying to choose the person that you're looking at that's going to be the best fit for what you're doing, and that has some kind of skin in the game and that wants to. If you go to your rep or your senator, a lot of times because you're a constituent, they'll take it and they'll put it out there. Doesn't mean they're the right fit. They may then move on to something else.
We might want to move on to the next slide.
Yes.
We're getting into what are the factors to consider when you're thinking of who to approach, be your legislative champion, who is best positioned to carry your bill, who is going to be willing to do that. And here are a few things. Chase, I know you could speak at length on any of these points, and there are others.
Yeah, and I think these are some key ones. And y'all are from all different states, so what we do here may not fit. But in Texas right now, you have to look at the power base. Who has control of the power base, and are they going to be the best fit to move something forward? A lot of times CTD, and personally, I will try and maneuver having a Republican carry a bill, especially if it's going to be a controversial bill that might cause some issues, because I might be able to get them to push others to join it. When it comes to Medicaid and it comes to healthcare, it's sometimes a difficulty because appropriations, we spend a lot of money in Texas every year. And the state is very conservative in its spending. So you have to look at, you're competing with all these other interests wanting funds that need funds. So finding the right party affiliation for what you're carrying in that time and circumstance. You know, I don't always go to Republican. We do have Democrats that carry certain legislation, but if that's happening, I'm probably looking at what committee they may be in and chairing that might help us move it. That Democrat may be working with another Republican, which happens sometimes in Texas, and you can get some cross-pollination and agreement to move something. You know, we have issues between our House and our Senate. If a bill doesn't pass on one side, they may hold another bill hostage on the other side. So you're always playing this game of chess. But I always start by looking at which party may be able to move this better. And then looking at seniority. The higher up in the level of seniority you can get, the better your bill has a chance to pass. We always try and make sure that somebody, you know, we have to have in Texas a Senate sponsor and a House sponsor. So we try and make sure one of them has some significant seniority, be it in a committee, something like that, that allows us to kind of move something forward a little easier. You know, looking at their relationships currently at that time makes a big difference. And making sure we cover both houses.
Yeah, sometimes a bill will get stuck on one side, say in the Senate, but if your House bill is still moving, you've got a chance to, you know, keep your bill going through the process. So that's
yeah. And even on this bill, I know the multiple times we filed this and other bills, you know, even in elections, we always try and leave ours open enough so that if the bill is dying on the floor or something's happening, we can try to revive it and amend it onto someone else's bill at the last minute. It works every now and then. But I know Dennis, when he was my ex-boss, was working this, he was going around to any and everybody if there was the slightest mention of Medicaid and dental, trying to slide it into these gigantic bills that had to pass to make sure that it got through. It's never an easy lift, but the more they see you, the more you're there, the harder it is for them to keep turning people away on certain issues.
And if you've got somebody, a legislator, who is also fighting for that, I mean, that's just, it's critical.
Yeah.
So we're gonna go on to the next slide. We've got another chat question for y'all. Just listening to this, what are you certain of, or what might be some key characteristics of a legislative champion for a Medicaid dental benefit bill in your state? We know that Texas is a unique place with its own unique landscape. And so maybe some of the things we've been talking about, focusing on bipartisanship, but definitely getting buy-in from the more senior conservative members of the party. That might not be a strategy that will work in your state. So if this is sparking any ideas about who you might target as a legislative champion, please let us know in the chat. And then we'll move to the next slide. And so, yeah.
Sorry, Laura, I'm just, I jumped
you're just going. Go ahead.
Yeah, I'm not very timid, as y'all can probably tell. Tips for approaching a legislator about, you know, supporting your cause. What worked for us and what really actually was one of the main things is one of our past employees, Susie Angel, she had CP, used a power chair.
Hey, Chase, what is that?
Sorry, cerebral palsy. She used to slide out of her power chair at work. She drove it with her foot, and she used her nose to type. And all of our newsletters and all of our editing, was an amazing editor. And and she has recently passed, but Susie was a driving force behind this. And the amount of times that she testified in that building, um, she built up, some followings and some very strong legislators who started listening to her. And I think anytime you can get in that building and build on a relationship from the past, it's worth doing. And Susie engaged in multiple areas that affected the disability community. And even for us, we did not always agree with Senator Colkhorst on a lot of things.
And who is Senator Colkhorst?
Senator Colkhorst was one of the authors of the bill. And she is also one of the chairs of one of the main Health and Human Services committees in the Senate. Very well could end up being our next lieutenant governor down the road. So she's a very powerful individual in that building. She also weighs in a lot on appropriations, where, this was going to take money to do. And having someone like that can push really can help a cause. And I think when you're approaching them, you want to approach them ahead of time, give them as much information, and be receptive to just, any questions they have, helping them fill it out, the whole idea of why this is important, how this benefits not only the state, the community, but that it's the right thing to do. And, make it to where they have that buy-in and that belief. And I think that's really important too, like having advocates that, like Brooke. When Brooke and I had talked multiple times, Texas advocates came out and really did a lot for this, and they played a very big role. Legislators get approached by lobbyists all the time saying, we have a problem, we need to do this. Real stories, even stories from dentists on issues they've had trying to help people get the care they need, and from those in the community, does play a big role, especially if you can find people that those stories are coming from their district. You don't always have to, but it helps. And I think that's an important thing. And anytime you make yourself available and you try and help them, and respect the legislators' time and their staff by getting back to them as quickly as possible, asking them if they don't think they're the best fit, who is the best fit? Can you help introduce us to XYZ legislator? You may find that chair doesn't want to carry another bill because they have too many, but that they're the ones who are going to be able to help you find the right person.
So that's kind of getting into our last slide, which is you've gotten a legislator to sign on to carry your bill and support you. Do you have, Chase, any other tips for like continuing to build and maintain that good relationship so that, next session, or maybe you're working on another piece of dental legislation, you can go back to them and say, hey, are you interested in doing this again? Yeah,
always be polite. First thing, you'd be amazed at how many people you get a legislative champion, you go through this whole process and their staff and they spend a lot of time, and then no one sends a thank you. That will stop you dead the next time you come and ask for any kind of assistance. Like, they have long memories, and you always want to make sure, that they know they were appreciated for what they did, even if it doesn't get passed. That can be a make or break for future bills passing. And the one thing I know I've learned over the years is it doesn't matter. You're never going to pass something perfectly the first time. There are way too many cooks in the kitchen. Once it starts the legislative process, that things can turn out differently, or the state agency looks at it once that law has been put in place, or appropriations. We still have to fight for funding. So there's always those next steps you have to do. So maintaining those relationships, and especially with staff, because like what we're going to deal with this next legislative session starting in January here in Texas, we have one of the biggest in my 18 years kind of rotation of House members that are going to be coming in. I mean, we have over 30, I think, new House members. That's a lot of people that need education, re-education. But there's probably one thing that'll come across with all of them is more than likely one of their staffers will have worked in another office before. So you may now have a new contact with a new representative or a new senator in your place. You always want to maintain that, and you always want to make sure to treat that person at the front door that looks like they're 12, that's answering the door, be very polite to them. Realize that they are the gatekeeper, even though they're an intern, and they have a lot more power than you think. Spend some time getting to know them, because they're the ones that are going to usher you or make sure your messages get through. And that is a big failure, because legislators listen to their staff a lot of times. And if you treat a staffer badly, or even unintentionally dismiss one of them, like you see the legislator and you blow past them, that can actually affect your relationship over time with that legislator.
Well, I see that we've got about 5 minutes left, so I want to start wrapping it up and hand it back over to Sam. I know that there is a ton more information about thinking through partnerships, legislative champions, building relationships in the toolkit. And I know that Sam has a little bit more about that and CEU stuff. So I'll turn it back over to her.
Awesome. Thank you so much. Thank you, Laura, Chase, Brooke, Ginger. That was amazing. Thank you so much for all of your valuable information. We are running out of time, so if you have any questions, please feel free to email us. I am also going to send right now in the chat some links to our CEU, registration for the next session, and our toolkit feedback form. You can also email AIDPH, and we can answer any questions that you might have. Let's see here. Yes, thank you all for being here today. The CEUs for today's session will also automatically pop up in your browser at the end of the session. Recordings will be on our website. It does take a few days for them to get up. Please do take a minute out of your day to review the available sections of our toolkit, and also don't forget to register for the next session in September. Thank you to everyone who is here today. Thank you for participating, and we hope that you have a wonderful week. See you later.